Hello and Assalamu alaikum. Ultrascan diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the all four molars. This is the all four first molars. So this is the 3D rendering. On the 3D rendering, we don't see anything major except the upper left second molar where there is a periapical radiolucency. On the panoramic view, we can see that there is a restoration on the lower right first molar. There is a root canal in the upper left second molar, and we've got generalized bone loss around the molars in the upper and the lower arch. Now, taking you to the transaxial view, the transaxial view is basically a proximal view. On the proximal view, you will be able to see we've got secondary caries underneath this amalgam restoration. We've got pulp stones present. The mesial root has two canals with an approximate working length of 20 millimeters. Moving to the distal canal, you've got one single wide distal canal. Sorry, let me just re-angulate this little. So we've got a distal canal which starts as one and then converts into two and then joins to form one at the apex. So we've got a 1-to-1 or a 2-1 configuration in the distal canal. Taking you to the axial view, this is the axial view of the lower right side. So this is how the canal starts as one, in the distal converts into two separate canals here, and then eventually joins to form one at the apex. The mesials are two separate canals. We don't see any cracks or any problems in the teeth as such, but there is bone loss more so on the lingual aspect and the distal aspect. So there is definitely these teeth are periodontally compromised along with the second molars on the lower right hand quadrant. Moving to the upper right hand quadrant, this is the upper right first molar. So we've got the mesial root which has two canals, the mesiobuccal and the mesiolingual. There we go. Sorry, the mesiobuccal one, the MB1, and this is the MB2. So we've got two canals in the upper right first molar, we've got a palatal, and then we've got a distal canal which also has just one wide canal. We can see that there is a class 1 carious lesion along with the caries extending into the dentine, but this too does not seem to be giving any root canal indications. However, we do see PDL widening quite significantly in the upper right first molar. The lower left first molar, we can see that this tooth has, sorry, my apologies. So this tooth basically has two roots. So the mesial root has two canals which can be clearly seen here. If we give you an estimated working length, it's going to be 19 millimeters of the mesial canal, two separate mesial canals. As we move in the middle of the root, we've got a class 1, slightly class 1 with a little bit of a dentine shadow. And then we've got one wide single distal canal with approximately the same or almost same working length, which will be 19.2 millimeters. We have significant bone loss on the lower left side. So this is the buccal cortical plate. This is the lingual cortical plate. We can see that the lingual cortical plate has gone down quite significantly, and probing depth in this region will be close to almost 6 millimeters. Moving to the upper left first molar, the upper left first molar has three roots. The mesial has again two canals, the MB1 and the MB2 can be seen here. We have pulp stones present in the upper left as well. This tooth has PDL widening and furcation involvement here as well, as you can clearly see between the mesial and the palatal. The palatal root approximately has a working length of 21 millimeters, whereas the distal root again has one single canal. An approximate working length would be 19.4 millimeters. If I can take you to the axial view of the lower left, so this is the lower left where my mouse is. We've got a two canal configuration in the mesial, and we've got a one single canal configuration in the distal. taking you to the upper aspect. So this is the upper aspect. We've got MB1, MB2, distobuccal and palatal, MB1, MB2, distobuccal and palatal. The MB2 is very faint, but it is definitely present in these teeth. So if you have any further questions, please feel free to reach to our team. Thank you very much.